Managing diabetes isn't just about cutting back on sugar and taking medication on time. While those are crucial steps, what's often overlooked is how essential nutrients, especially certain vitamins, can significantly impact how well your body manages blood sugar, insulin function, and overall health. Surprisingly, many people with diabetes suffer from hidden vitamin deficiencies without even realizing it. This can lead to worsening symptoms, poor energy levels, increased risk of complications, and even reduced effectiveness of insulin therapy. Let's dive into the top 3 vitamins every diabetic should take, how they affect your health, signs of deficiency, and the best food and supplement sources to help you stay ahead of the game. 1. Vitamin B6. Vitamin B6, also known as pyridoxine, plays a pivotal role in dozens of metabolic processes, but for diabetics it's even more critical. When blood sugar levels are elevated, your kidneys work overtime to flush out excess glucose, but they also flush out B6 in the process. Furthermore, inflammation and oxidative stress, both common in diabetics, increase the body's demand for B6. To make matters worse, medications like metformin and blood pressure drugs can deplete B6 levels even more. Without enough B6, insulin resistance worsens, nerve damage accelerates, energy levels drop, and the risk of complications like diabetic neuropathy and kidney issues increases. A deficiency in vitamin B6 might not always be obvious, but some common signs include constant fatigue, brain fog and mood swings, tingling or numbness in the hands and feet, muscle weakness or poor coordination, and dry, flaky skin or frequent mouth sores. In severe cases, you might see anemia, infertility and worsening diabetic retinopathy. Now let's talk about the health benefits for diabetics. Vitamin B6 supports nerve repair and muscle coordination, which honestly can make a real difference for those managing diabetes. It also helps maintain hormonal balance in both men and women. Plus, it plays a role in the production of dopamine and serotonin. Those are the chemicals that influence our mood and energy levels. B6 is important for glucose metabolism as well, helping to break down glycogen so you get steady energy throughout the day. And it supports heart health by lowering homocysteine levels, a compound linked to artery damage. You can naturally boost your B6 levels through certain foods. Chickpeas, for example, provide about 55% of your daily needs in just 1 cup. Beef liver is another excellent source, with 50% per 100 grams. Wild-caught salmon and turkey each offer around 40% per 100 grams. And don't forget sunflower seeds. Just 1 ounce gives you about 30% of your daily requirement. If your diet isn't quite enough, there are supplement options to consider. Look for P5P or pyridoxal 5-phosphate, which is a bioavailable form your body can use right away. Some good brands include Thorne Research, P5P 33 mg and Pure Encapsulations B650 mg. The typical dosage is between 25 and 50 mg per day, but it's always a good idea to check with your doctor if you think you might need a higher dose. 2.
Vitamin E.
Vitamin E is, well, a powerful fat-soluble antioxidant that plays a vital role in protecting the nerves, blood vessels and organs from oxidative stress, which is, a major concern for diabetics. Diabetics experience increased oxidative stress, which means your body actually burns through vitamin E faster than normal. On top of that, poor fat metabolism, which is pretty common in diabetes, makes it harder to absorb fat-soluble vitamins like E. When vitamin E levels fall, nerve cells become vulnerable, circulation worsens, the risk of heart disease rises, and both immune strength and tissue repair decline. Many early symptoms of vitamin E deficiency are subtle, but they can include muscle weakness, numbness or tingling in the hands or feet, dry skin, slow wound healing, night vision problems or eye strain, and frequent infections. So, let's talk about the health benefits of vitamin E for people with diabetes. Vitamin E is really essential for a few key things. It helps protect your nerves and can actually reduce pain from neuropathy, which is a common issue. It also supports heart health by keeping your arteries flexible and preventing cholesterol from oxidizing. On top of that, it boosts your immune function, helps with hormonal balance and fertility, and, well, it can improve your insulin sensitivity by lowering inflammation. If you're looking to boost your vitamin E intake naturally, there are some great food options out there. Sunflower seeds are fantastic, giving you about 2/3 of your daily needs in just an ounce. Almonds are another solid choice, with nearly half your daily requirement per ounce. Hazelnuts provide about a quarter, and cooked spinach gives you around a fifth of your daily needs per cup. Oh, and don't forget avocados. They offer about 15% per fruit. Now, if you're considering supplements, it's best to choose natural D-alpha tocopherol over synthetic versions for better absorption. Some top brands include Pure Encapsulations Vitamin E 400 IU and Now Foods Vitamin E 400 IU. The usual dosage is between 200 and 400 IU per day, but, and this is important, don't exceed that amount without your doctor's advice, since high doses may thin your blood. Now, let's talk about, well, things that can actually deplete your vitamin E levels. Processed vegetable oils like soybean or corn oil can really lower your stores. Refined carbohydrates and sugars are another culprit. Alcohol, too, plays a big role in depleting vitamin E. Low-fat diets, believe it or not, can also be a problem. And if you overcook your vegetables, that can strip away a lot of this important nutrient. 3. Vitamin C. Moving on to vitamin C, which is, often overlooked in diabetic care. Vitamin C is one of the most powerful antioxidants and cellular repair agents your body has. And for diabetics, it's absolutely critical. So, why is vitamin C so important? Well, vitamin C uses the same cellular pathway as glucose, so when blood sugar is high, vitamin C absorption is actually blocked. To make matters worse, the body tends to flush it out quickly through frequent urination. Diabetics already face chronic inflammation, and low vitamin C levels can further worsen insulin resistance and lead to damage to blood vessels and organs. Right, so let's talk about some of the signs of vitamin C deficiency. You might notice things like fatigue and, well, just general sluggishness. Wounds may heal more slowly than usual. There's also easy bruising and bleeding gums to look out for. Some folks experience dry skin and more frequent infections. Joint pain or stiffness can crop up as well, and in more advanced cases it can even lead to iron deficiency anemia. Now, when it comes to the health benefits for diabetics, vitamin C really does play quite a few important roles. It helps reduce oxidative stress, which in turn can improve how insulin works in the body. Vitamin C also supports collagen production, which is vital for healing wounds and keeping skin healthy. It protects your blood vessels too, helping to prevent plaque buildup and keeping those arteries nice and flexible. Plus, it gives the immune system a good boost, reducing the risk of infections. And of course, it can help slow down complications like retinopathy, neuropathy and kidney disease. All right, let's talk about the best food sources of vitamin C. Some of the top nutrient-rich choices include kakadu plums, which actually provide an astonishing 30 times your daily value per 100 grams. Next up, we have acerola cherries, offering 16 times your daily value per 100 grams. Red bell peppers are also a fantastic option, giving you double your daily value per 100 grams. Kiwis are impressive too, with about 1.5 times your daily value in just a single fruit. And of course, don't forget strawberries, which provide nearly your full daily requirement per 100 grams. Now, if you're considering supplements, let's look at your options. The best absorbed forms are usually liposomal vitamin C or ascorbic acid. Some of the recommended brands include Livon Labs liposomal vitamin C, 1000 milligrams, and Pure Encapsulations ascorbic acid, also at 1000 milligrams. The typical dosage is between 500 and 1000 milligrams per day, or sometimes even more during illness or periods of stress. Of course, it's always best to check with your doctor before making any changes. So, what actually lowers your vitamin C levels? Well, high sugar intake can compete with vitamin C in your body. Alcohol and smoking are also major culprits. Processed foods can have a negative impact, and overcooking vegetables can really reduce their vitamin C content too. Why these 3 vitamins matter most? When it comes to managing diabetes, addressing vitamin deficiencies can honestly be a real game changer. While medication and lifestyle changes are absolutely vital, making sure you get enough vitamin B6, vitamin E and vitamin C will help improve insulin sensitivity, protect your nerves and blood vessels, support your energy, fertility and immunity, and help prevent or slow down long-term complications like kidney disease, heart disease and neuropathy. Whether you choose a nutrient-rich diet or well-chosen supplements, getting enough of these vitamins may drastically improve how you feel and how well you control your diabetes. Oh, and here's a pro tip. If you're experiencing frequent infections, slow healing, nerve pain, or constant fatigue, it might not just be your blood sugar. So do talk to your doctor about checking your vitamin levels and optimizing them as part of your diabetes care plan.